Revenue cycle terminology, letters E through H. Flashcards, terminology followed by definition, glossary of terms from NAHAM and AHAM. Electronic Protected Health Information, EPHI. Any protected health information, PHI, as identified under HIPAA, that is produced, saved, received, or transferred in an electronic format. Electronic Health Record, EHR. A real-time digitized version of a patient's medical history that allows secure information access to authorized users. Standard clinical and medical data is gathered by a provider and stored in electronic files. EHR goes beyond a single provider and can contain shared information from multiple providers to develop a comprehensive patient history. Emergency Medical Treatment and Labor Act, EMTALA. Anti-dumping statute, federal law protecting patients against discrimination regardless of ability to pay, mandates patients receive a medical screening exam and stabilizing treatment when seeking emergency medical care or when in active labor. Emergency services. Patients examined on an unscheduled emergent basis for immediate treatment in the emergency facilities of a hospital. Depending on the outcome of the exam and treatment, the patient may be admitted as an observation patient, admitted to the facility as an inpatient, or transferred to another facility as deemed necessary by the physician. Ethnicity. A social group that shares a common and distinctive culture, religion, language, or the like. Exclusions. Certain procedures are excluded from the plan. Asking the insurance company will let you know what services are not included and covered in the plan. Fair Debt Collection Practices Act, FDCPA. Federal law prohibiting debt collectors from using unfair, abusive, or deceptive practices while attempting to collect from a consumer. False Claims Act. Federal law targets fraud against the government, whistleblowers. Provision allows non-government individuals to blow the whistle in good faith on fraud against the government who may receive up to 30% of any recovered damages. HCAHPS. Also known as Hospital CAHPS, it stands for Hospital Consumer Assessment of Healthcare Providers and Systems and is a standardized survey of hospital patients that will capture patients' unique perspectives on hospital care for the purpose of providing the public with comparable information on the hospital quality. Health Exchange. Health insurance marketplace or exchange, organizations that facilitate structured and competitive markets for purchasing health coverage. Health Information Technology for Economic and Clinical Health Act of 2009, HITECH. Federal laws simulating the adoption of electronic health records and providing financial incentives for demonstrating meaningful use. Also expanded HIPAA security and privacy rules and increased penalties, established data breach notification rules. Health Insurance Portability and Accountability Act of 1996, HIPAA. Originally focused on regulations related to health insurance portability, focused on administration simplification and reduction of cost through the protection and standardization of electronic and financial records. Most known for the privacy rule and security rule, these rules define standards for healthcare and protected healthcare information, PHI. Health Healthcare Facilities Accreditation Program, HFAP, an accrediting organization tied to Medicare conditions of participation coverages. HITECH Omnibus of 2013. This update to the HITECH Act revised provisions that focused on an individual's right to request restrictions on the disclosure of PHI, restricted disclosure, and on an individual's right to access his or her PHI stored in an EHR. Hospice, a non-profit organization dedicated to patients and families facing serious illness or death. Hospice provides a support system to patients and families who choose to share their last days together in the comfort of their home or hospice designated facility. Hospice provides a wide range of services that include coordination of care with the patient's primary care physician, skilled nursing visits, spiritual counseling, and social worker support. The hospice staff are an interdisciplinary team who coordinate an individualized plan of care for each patient that is directed by the primary care physician. Hospice care is a covered service under the Medicare program.